Free COBRA health insurance is coming to an end 1 month from today. At the end of September, the full COBRA subsidy that maybe you've enjoyed or a family member has enjoyed, that's coming to an end. However, you can still get free health insurance. I'll tell you how coming up. My name is Mike Bernard. I'm the host of the Wise Money Show. I'm also one of the certified financial planners right here at Korhorn Financial Group. Make sure you hit that subscribe button, turn on notifications, and smash that thumbs up button. If you've been on COBRA this year from an involuntary termination or involuntary retirement even, where it was forced upon you to leave your employment, you've been receiving a significant benefit. At least I hope you've been. That means you were eligible for fully subsidized COBRA from April 1 until September 30th. That's right, that's free health insurance. Well, not really free, someone else is paying for it. It's the government. Wait, that's us through taxpayers. But anyway, in the American Rescue Plan Act, if you were on unemployment, you were involuntarily terminated, okay, from your employer, then you are eligible to stay on COBRA and have it be fully subsidized by the government. And you've been enjoying that. However, that comes to an end September 30th. So let me tell you a story. I met with Margaret and her husband last week. So Margaret was let go from her job at the very beginning of the pandemic. Okay, very beginning of the pandemic. And we've been doing comprehensive financial planning, something we call One Plan, looking at all 6 areas of their financial life, their goals and objectives, and then how their financial life and the decisions that they have at their fingertips, how those decisions can bring synergy to all 6 areas of their financial life and help them achieve their financial goals. So at the beginning of the pandemic, when she was let go, we talked about the risks and the challenges, obviously the emotions of that, but obviously we then got to the finances of it. And she said, gosh, I'm gonna look for another job, and they've given me a severance because she was with this company for a long time. I'm gonna get this severance for about 6 months, which was just wonderful. And then I'll get on unemployment, but boy, could I retire. Now, Margaret's husband was already retired. He'd been a laborer for a long time, so he was retired and just living off of his IRA, not drawing his Social Security because she was still working. She was still a couple years away from retirement, but looked and said, it's going to be difficult for her to find a job. Now, again, this was back during the pandemic when things were just rough. Now we have more job openings than we can even fill. But then also there were the health risks, and her husband already being retired. It was, could I swing it? Could I retire early? And so we did all the planning work. Now, it was a huge benefit that we'd been doing it all along. So I knew their financial life like the back of my hand, as well as my own financial life. I knew their financial life. And so we had a few meetings where we talked through everything, and I had them do their budget, and we updated their financial plan, their retirement plan. And yeah, guys, I mean, through a lot of analysis, Margaret, you're able to be done. You're able to retire. So if you find another amazing opportunity that you want to re-enter the workforce for, wonderful. But if that doesn't come around, or if it's the best decision for you guys, go ahead and be done working. And she cried. It was an emotional, very meaningful discussion. Now, obviously, part of that whole discussion was figuring out health insurance and health care. She's not yet 65, and so we had lots of planning. In fact, this is, as you're going to see in just a moment, this is kind of the crux of our retirement planning and financial planning right now. It's hinging on health insurance. And so she and her husband met with one of our health insurance experts, looked at all of the analysis, and of course, I weighed in the cost structure and the actual type of plan, the health insurance plan that they should have as part of their retirement plan and financial plan. And it was best for her to be on COBRA. So she was on COBRA. She was eligible for 18 months. And again, she got this, she had unemployment, she had a severance for about 6 months before she'd go on unemployment. So we elected to go with COBRA. And then when COBRA was done, the plan was before she was on Medicare, we were going to keep their income low enough so she could get on the Affordable Care Act, healthcare.gov, and get insurance through a subsidy. And there's all sorts of creative planning that went in to make sure their budget was all right and their retirement income was going to be set up so that they'd be allowed to get these subsidies. Lots of creative planning. Well, she rolls off of the severance, gets on unemployment near the end of last year, and she's been on unemployment for several months here in 2021. March rolls around of 2021. The American Rescue Plan Act is passed, and I send Margaret and her husband an email and said, guys, I'm not sure if you've heard this or not, or if you've heard from your employer, but you are now eligible for fully subsidized COBRA. You can get COBRA at no cost. Make sure you contact your employer. Of course, they were ecstatic. Sure enough, a week later, heard from their employer. They were able to get COBRA at no cost through September. Well, I had a meeting with her and her husband last week. And I told Margaret, hey, you're transitioning off of COBRA at the end of September, but there's great news. Also in the American Rescue Plan Act is, and here's the key point. So those of you that have been enjoying COBRA at no cost, what do you do when that benefit, when that subsidy expires at the end of September? I mentioned that Margaret's been on unemployment this year. If you or your spouse, if you're married, have been on unemployment for even just 1 week, or guys, even eligible for unemployment at some time in 2021, from July until the end of the year, you're eligible for a silver plan through healthcare.gov, through the Affordable Care Act, and are eligible to get a silver plan fully subsidized. That's right. Check out this link. I'm going to link it below as well, but this is directly from healthcare.gov, the benefits and their new plan that if you've been on unemployment for even 1 week, you or your spouse, or even eligible for unemployment, you or your spouse, even for 1 week, you're eligible to get a silver plan fully subsidized. So Margaret, her husband, again, already retired. He's been on Medicare. Margaret is going to be able to transition directly from COBRA when it ends its full subsidy at the end of September, directly onto a silver plan and continue paying no cost for her health insurance for the rest of 2021. That is something we did not have factored in that original retirement plan last year after she got let go during the pandemic, but it's been an amazing benefit to them financially as they have transitioned into retirement and managing their cash flow, managing their budget in these early years of retirement. So that's a huge, huge deal. If you are on COBRA right now due to an involuntary termination, make sure you're getting this full subsidy. My goodness, if you're listening to this right now and you've been paying for your own COBRA, even though you were involuntarily terminated, you need to reach out to your employer and say, wait a second, why have I been paying this? Am I for some reason not eligible, or is there something I don't know about here? Because you should have been fully eligible. If that's you, and that full subsidy is going away at the end of September, work with your certified financial planner and go speak with a health insurance expert. You should, if you've been on unemployment or have been eligible for unemployment at some point in 2021, you should be able to transition directly onto a silver plan, which is still decent coverage. You're going to want to work with that expert to make sure that your care providers, your doctors, your hospital that you prefer to go to is in network for that plan. Your prescriptions and all that stuff have the right type of coverage for that plan. But a silver plan is good coverage, okay, for fully subsidized regardless of your income for the rest of 2021. So that's your action item. Also, here it is, end of August, early September. It's not too early to also be thinking about next year. That subsidy, that full subsidy for a silver plan runs out at the end of this year. Therefore, what's your health insurance choice for next year? Sat down with Margaret and her husband during the same time. I told them good news, you'll transition to the silver plan, but then next year, here's what we're looking at for income, and therefore here's what we're looking at for a premium tax credit and what Margaret's health insurance will transition her at that time from a silver plan to a bronze HSA plan for next year. That cost should also be lower because of some of the enhancements they've made to the premium tax credits. It won't be free next year, but it will be very, very low, and they will be able to keep their income below those limits so that health insurance cost can be very low. Hopefully that makes sense. Lots of spinning plates with this one, but that's the power of comprehensive financial planning, that you can see when life throws you a curveball. Am I able to retire, or do I have to re-enter the workforce? How can I get the best health insurance coverage and be able to retire early? If there's subsidies or if there's premium tax credits available to you, how do I structure my income to stay below that? All of that we've covered and a lot more. So work with your certified financial planner. If this impacts you, make sure you've got a health insurance expert that can navigate these changing rules. And of course, if you ever have any questions, you can always contact my team of CFPs and health insurance experts. You'll find us online at korhorn.com. That's Korhorn with a K. wisemoneyshow.com. You can find us there as well, or give us a call, 574-247-5898. All right, there you have it. Go out and take your next wise step in your financial life.